Obsessive Compulsive Disorder is a condition characterised by intrusive, unpleasant, unwanted thoughts, images or urges that intrude into the individual's mind against their will. They create considerable anxiety or discomfort, and the person feels that they've got to do something about these thoughts and will often engage in compulsive behavioural rituals that may or may not be connected with the actual thought itself, or they'll engage in what we might call cognitive rituals, where they have to say things or do things mentally to neutralise that particular thought. Look, about 2% of the population here in Australia will experience full-blown obsessive compulsive disorder in any 12-month period. It's 1-to-1, yeah. It doesn't seem to affect more women than men, etc., like the other anxiety disorders, but it is pretty much equal across the sexes, though the onset can be earlier for males. With all of these conditions, it's multifactorial. There's no single cause. We talk about personality variables, some of which are under genetic control. There are other familial factors that may be under genetic control, the environment, etc. So there are many factors that are involved in the development of OCD. It affects family members in that none of us like to see loved ones in distress. So often family members will find themselves accommodating the OCD. So allowing lengthy showers, allowing lengthy checking rituals, reassuring the person that there is no danger, that nothing bad is going to happen. There's two main treatments that can be used independently or together in combination. So particular types of medication have been found to be useful in the treatment of obsessive compulsive disorder, particularly the serotonin reuptake inhibitors. And in terms of psychological treatment, the treatment of choice is still exposure and response prevention, or cognitive behaviour therapy, where we expose the individual to situations that they fear so that they learn eventually that there is nothing to fear and the dreaded outcome doesn't actually occur. Well, you'll probably find that with OCD and other anxiety disorders and depressive disorders, that there are high rates of comorbidity, particularly throughout the individual's lifetime. And what that basically means is that there's a shared vulnerability to many of these conditions, so that if someone has an anxiety disorder, they're more than likely to have other anxiety disorders throughout their life and depressive disorders as well.